This is another look at the test device with a little higher Fitzpatrick scale 3, and you can see that you know, the images are certainly a little concerning. We're getting differences in that reflectance signal based on, you know, how we image. Compare it to this, even in the higher range, this is where melanin really give the test device a headache. This is a Fitzpatrick 3 to 4, and certainly the even darker patients, the images are even worse. But you can see the STO2 devices, again, the same test using a tourniquet, and I can't make any inference of the STO2 that's being returned from the test device in the darker patients. It just doesn't perform well there. And Travis, you're talking about the difference in technology. I think this, you know, this is all light. This is all photonics. This is illumination. So if you have an inferior device with poor illumination, poor or less intense NIRS signal, or less signal being sent out, the image return is not going to be as good, and they're going to struggle when it comes to higher melaninated patients. So let me show you what Kent has done. Here you see a Fitzpatrick 1-2 on the upper panel, and a Fitzpatrick 4, 5 or 6 maybe on the lower panel, clearly a 5. And this is the NIRS signaling, again, with a tourniquet on that digit, and you can see that you can detect the amount of ischemia after the tourniquet. The non-tourniqueted image in the center panel are very consistent between these patients, and this is a normal patient. These are normal STO2s. This is what you'd expect to see in a normal patient. These are also what you'd expect to see when you tourniquet that patient, but yet the test device can't do any of this.